An Asheville medical practice is conducting a COVID-19 study. They're testing more than 500 patients to see if any previously had COVID-19 and were asymptomatic. The doctor running the study is seeing mostly negative tests, which says she says it has a significant downside as we begin to reopen our community. Here's News 13's Kimberly King.
The Asheville internist doing this study says the more data and information we have on testing in the community, the better. She says all her patients eagerly signed up to be part of this study, doing the nasal swabbing and also the COVID antibody testing.
These are photos of 3 patients' antibody tests, each with a red line well above the positive antibody lettering, indicating all were negative.
What we've seen is an overwhelming amount of negative.
Dr. Carly Brown of the Ashewell Medical Clinic is conducting the study,
which means people have not been exposed and do not have immunity.
And what that means is that the Asheville area, she says, so far has a low caseload.
It means that we did a very good job in the last 2 months protecting ourselves from the virus. The downside of that is that we may not have the immunity that we think we had.
Brown has lined up 500 patients getting the nasal swab COVID virus test and the antibody finger prick test.
My name is Martha WORLEY. I am 73 years old.
Martha got both tests done.
I participated in this project because I think testing for the COVID virus is really important. My test results were negative.
With that, patients know that they don't have any antibodies that could potentially ward off COVID-19 as North Carolina begins to reopen.
Look how many people come here for their second homes. I think that what we can expect is to have visitors.
Of the 120 patients tested so far, only one who traveled from New York to Asheville tested positive for antibodies.
We do want to be careful as people go back to work, as we open our doors in Asheville, in Buncombe County, in Western North Carolina, because that will result in people being exposed with greater rate and possibly getting complications from COVID-19.
This has been an extremely hectic time for all of us.
Chairperson Blair Craven started this social distance meeting. First item, the reading of pleas from students.
I was looking forward to enjoying my senior year. Most importantly, I was looking forward to graduation.
The cap and gown and walk across the stage will not happen due to something beyond anyone's control, coronavirus.
There were lots of things we thought would never exist in public education that now do.
Dealing with a budget shortfall of more than $3.5 million because the county has its own financial issues.
We're going to have to start tightening our belt.
While still handling construction, infrastructure upgrades, and critical safety projects already under contract.
Many of our elementary schools have no security cameras at all.
There was a COVID-19 policy report from the state board, and one item was altogether new, but not altogether popular: virtual school from home.
A teleworker's alternative work location must be safe, secure, and free of undue distractions. All those.
Someone come get my kids.
Don't come to my house.
I think that's pretty daggum ambiguous to start with.
Perhaps the biggest change, flex to traditional calendar for all, beginning on August 17th for the entire 2020-2021 school year.
It is important for us, these kids, to celebrate together. It is so important.
As for the class of 2020, there are options still being discussed.
I do want to celebrate these kids, but we've got to do it in the right way.
They will graduate, but not side by side.
According to the North Carolina DOT, any local license plate agency can issue a 10-day temporary tag. While hours may be reduced, many tag and DMV locations are open, some with curbside service. Governor Roy Cooper recently signed a one-time 5-month extension for many DMV services. That includes about 27 different services and extends the use of learner's permits to temporary vehicle registrations for 5 months. The DMV has also expanded some online services.